Welcome back. Thanks everyone for coming to my channel and checking out my vlog on my open heart recovery, surgery recovery. If you're new to the vlog and new to the channel, please check out one of the first ones that I've done. You get some of the background about why I needed the surgery and a little bit about me. Today, the video we're going to talk about is the day after surgery. The last video we talked about the surgery day itself, everything that happened. It was kind of a bit of a blur. The day after was really an eye-opener for me. I should have known when I moved to the step-down unit from the ICU that things were going to be a little bit intense. The nurses were referring to me as the rabbit, which means rapid access bounce back telemetry, which I think that means a term they use for patients who need to get it back on their feet and move around really fast. And maybe a piece of equipment they had on me, I don't know, but that should have told me what to expect. I'd expect there to be a lot of sleeping and chilling and relaxing and getting back up to speed. Not the case. It was go, go, go. So let's get into the details about what happened. When I got to the step-down unit from the ICU, every hour I was having somebody come and pricking my finger to check my blood sugar because I was on an insulin drip. Their understanding or their thinking is that if they control the blood sugar level of their patients, it helps improve the healing. So even if I'm not diabetic, but everybody does the insulin drip thing, they still need to check the blood sugar every hour or so. And when they do that, they use a newer kind of little prick machine where they just kind of scratch it. I've had those before, when I was younger, and it really hurts your finger. This time the new stuff is just like you scratch your finger over a nail. It doesn't really hurt that bad. So it didn't really bother me, and I had plenty of fingers for them to work with. So they would also come in every hour and do a bunch of vital tests, taking my blood pressure, heart rate, my temperature, doing the O2 reading where they had that little clip on your finger. Not bad, no big deal. They'd also ask you how your pain was doing. And when they talk about your pain, they ask you to give it in a scale of 1 to 10. 1 being the least amount of pain, 10 being just agony, suffering, all that kind of stuff. And for the most part, throughout the time I was there, when my pain was under control, it was about a 2 or a 3. Pain in my chest, pain in my arms, and when it was the worst, it was about a 6 or a 7. And I never really knew what rough pain was until I started doing this. And then when you start shivering, that to me, that's when you're shaking with how much it hurts. That's probably the most I've had to deal with. So it wasn't often, and it was mostly my fault for not talking to the nurses enough and telling them, hey, I'm a little sore, or, give me the big gun pain medicine. I'd always go for there's 2 kinds they offered me of pain medication. I always go for the lighter one. I don't know why. I don't know if it's just because of the stigma about using pain medicine or what, but I got over that pretty quickly. So lesson learned. The night nurse who had me that first night when I was transferred from the ICU, right before she left, she removed the urinary catheter for me, which is a embarrassing thing to do. And I told her, I said, I'm so embarrassed. She's like, don't worry, I do this all the time, just so you know. I mean, the urinary catheters are pretty long, and I'm sorry to tell you this is gross, but I promise full disclosure in these videos. And when it gets at the very end, there's a bulb at the end of the catheter to kind of hold it in place. It's filled with water. So when they are removing the catheter, they have to take a syringe to that bulb and remove all the water, and then it comes out. So it's just a little uncomfortable. It's not painful or anything, but it's not my favorite thing to have those things removed. That day I also received my incentive spirometer. I'll show it to you in another video. It's a little plastic contraption with a tube that you have to inhale really hard and try to get to a certain amount of milliliters. It's a way to increase your pulmonary or your lung function. Because when you're under, your lungs kind of collapse and close up, and a lot of mucus and nasty stuff kind of congeals at the bottom. So when you're trying to get back up to speed, you got to kind of break everything up and improve your lungs and try to work them out too. So this thing became the bane of my existence for the last couple of days. It's almost like a love-hate relationship. I know I needed to do it, but those first couple of days with it just sucked because I had the chest tubes in and I was supposed to use it a lot. and every time I take a deep breath with the chest tubes in, it would hurt a lot. So I needed to get to like a level of 1250 milliliters. I was only getting to like 500 milliliters. It was brutal. Well, the people that were watching over me at the time, and typically when I was in the step-down unit, it was a regular nurse who was in charge of me and a couple other patients, then a tech who was like assisting her, and then there's a charge nurse who's in charge of probably a couple different sections of nurses. And they're all great, all great. That first day, I had an amazing nurse, amazing tech. I didn't really see the charge nurse that much, but the nurse and the tech were super cool. And the nurse was known around the floor as the colonel. So I didn't know that until about a couple hours into her shift. She was really sweet, but then she started to put me to work, man. And I would try really hard to use the spirometer, and she would say, "That's not good enough. Little babies do 500 milliliters. Come on, don't be a baby. Come on." So she was really, pulling out all the guns. And then, unfortunately, the tech came and come ahead early and told me that she was a bit of a driver. So be careful and don't take it personally. She, the idea again, the thinking is, the more you stay in bed and don't do anything, the less of a chance you have to heal, and you got to push it if you want to heal faster. Every day you stay in bed is a day, it's another day, and it makes it harder for you to get out and really improve. So I bought into that. I knew it was going to be tough. I knew it was going to be difficult. I have a lot of friends who are nurses or are married to nurses, and they said, just listen to what they say. I know nurses run those joints, man. They're awesome people, and everyone that I had was fantastic. So the colonel and I had a bond. We worked really hard that day. It was difficult. That day I wasn't able to eat anything. The first day I was on liquids, so by dinner time I was having some broth for dinner, but I was mostly drinking juice and water. Initially, when I first got to from the ICU to there, that when you're trying to get over the anesthesia and everything, you only get like a couple ice chips every hour or so, and you're really parched. I mean, I was so thirsty. All I wanted was just a huge Gatorade to just pound down, but I couldn't do that. Just a couple ice chips, keep that down, no issues. Get a little bit of water, and then just go from there. By the end of the second day, I had a big bucket of water basically in front of me that I could take huge drinks from, and I was happy as a pig in poop. When I'm doing all that, they also give me a bunch of medications. They have IV, like I said, the IV drip for insulin, regular, I guess like lactose ringers, the regular stuff they give you for IV, and then I was taking an antacid, all the other stuff that I was doing, all the other medications they had me on, really give me a heartburn. They don't want me to have distress in the chest area. They also give me stool softeners, so you don't want to be locked up and have a lot of pain in the air in your stomach or anything like that. So that's the way they explained it to me. Also at that time they removed the tailbone pad. When they put you in for surgery, they put a little pad on your tailbone. It kind of goes from like your butt crack to the small of your back, because you're going to be laying down all the time, and they don't want you to get sore or have any issues with that. So they pulled this thing off. It's not bad. It's just like a Band-Aid kind of adhesive. That came off. And then as I'm sitting there, just taking stock, and during the day, I realized I had some kind of gel or ointment that they must have put in my eyes, because it was smudged on my face. I could feel really greasy and everything. Smudged on my eye, and it kind of was like a little burning, but it was not bad. It just felt really greasy. I really wanted to shower bad, but that wasn't going to happen for a couple days. And at one point early in the afternoon, they moved me from the bed into a chair, and that sucked. That move, getting up, early on was a pain in the, not a pain in the ass, it's a pain in the chest, but it's difficult. You're laying normally like you're laying on your back, and what you have to do is you can't use your arms to push like this, or push like against something, or push out like that. You have to rotate your hips and then go to your side, and then kind of do like a chicken wing, to kind of push yourself up. You have to chicken wing it and help yourself up. And then the whole time, there's a nurse and tech that had to help me out the first time. So they both had their arms around my shoulders and my arms, and help me move my feet out, and then they helped me and that first time really hurt. I mean, the chest tubes are still in. It just sucked, but it felt really good to sit up and then be able to stand up. Like I stood up with their help. Obviously, you rock forward, you 1, 2, 3, and they lift you up a little bit. They help you out, but it's up to you to use your legs and push off and stand up. And that was very rewarding to be able to do that, and amazing. And then to get in the chair, I wasn't really feeling sick to my stomach or anything, which I thought I might be. It was just a little sore, still a little, parched at that point. I really wasn't drinking too much by that point, but it was good to get there. So my folks were there, and they got to see me, like, because every time I was moving, I'm like doing one of these kind of noises, and they knew I was hurting, so it must have been tough for them to see that, but they put the brave faces on. Now, let's see. So after being in the chair for a while, it was time for the first walk around the cardiovascular unit. So they came to get me, and you have to unhook all the different monitors and everything from the plugs, and you have this big IV pole that comes with you. And basically what you're carrying on these IV poles, I got my insulin IV, I have the chest tube, that little briefcase with the measuring of whatever stuff is draining from the chest, that's coming along with me. The heart rate stuff, I have these bleeds that are still on me for like EKG and everything, those things are on there too. And I'm kind of pushing this thing along. Actually, the first time, the tech is walking with me, and she's holding on to that, and I'm just kind of doing my little thing, my old man style, kind of walking down. And that first walk was really cool. It was neat to get out there, and a lot of cute nurses and a lot of cute family members of other older patients that I was there. But it's hard to throw a game when you got chest tubes and you get your hairs, like this crazy greasy bedhead and all that kind of stuff. But I wasn't there for that. I was there to get my walking in. So you're supposed to do about 2 laps. I got back, made 3 laps because I felt really bad that I couldn't get to the 1250 milliliter point. At that point, I also had a small fever going, and my nurse, the colonel, was really laying into me because she thought that the chest was kind of closing up. If you don't do that spirometer stuff, it's really easy for you to get pneumonia or the flu or other kind of respiratory infections. So she was worried that something was happening because of that. So I had to keep doing that, and as much as it hurt, I was doing my best. I couldn't get above 500 milliliters. It was brutal. But I had another walk a little bit later, toward the end of the day, had some broth, and that was the roughest day of being in the hospital, because there was a lot of work going on, some pain, trying to get on, dealing with the pain aspect, understanding what I need to tell the nurses to control the pain, and then, feeling not despair, but feeling down that I wasn't able to reach the limits that they were telling me to. At that point, I was getting ready to settle in for a long sleepless night, and I just kept thinking about hopefully tomorrow they remove the chest tubes and I can do a lot better with the spirometer. So this was like the in the Star Wars kind of trilogy. This was like the Empire Strikes Back, where lots of rough stuff happens, and at the end you don't really know what's going to happen next, but something's gonna happen next, and hopefully the good guys win. And that's kind of where I felt at the end of the day. So thanks again for joining me in this channel on the video, and I'll be putting another one out for surgery day +2, and appreciate the support. See you soon. Bye.